Poor circulation in the legs, known as peripheral artery disease, is just one of the most debilitating diseases, according to those who suffer from it. 1 in 5 over age 60 has it. But we're here with the Leg Saver Hotline, 1-833-PAD. Legs, always give us a call and we will help you to understand your symptoms, help you understand the treatment options, and help you get to the right doctor for your presentation of disease. But you know, the Leg Saver Hotline is also about community, PADsupportgroup.org. And we bring that group to life every single Wednesday with an incredible hangout with our friends. We have Douglas here, our PAD Warrior Chief, and we have a brand new entry into the Global PAD Association's network. We have Andreen, who is joining us on the Leg Saver Hotline, and she's going to be answering the phones as well and helping you to understand what's going on with your PAD and help you to find the right treatment options for you. Welcome, Douglas. Welcome, Andreen. Also, we got our live studio audience that is here. Make sure you do, if you want to come in studio, info at padhelp.org. Also, if you're on YouTube, we have Joshua's right there, ready to grab your questions and your comments and whatever you want to say and bring them to us so we can comment on them live and answer any questions you have as well. But hello to Heinz, hello to Thomas and everyone else. And welcome, welcome, welcome. Douglas, any special
Hi.
words for Andreen?
I want to welcome you to the community. It's great to have you. You're going to be a very big asset, and we really are glad to have you join us.
Thank you, Doug. I'm happy to be here.
Yep. What have you learned? I mean, you're just joining us this week. Whoo, thrown you into the fire now. Anything that's kind of stood out to you? It's really funny because someone else you mentioned is actually in your same class and is also with us at the Global PAD Association, just joining us this week and helping out with the hotline. Anything that just stands out to you about this particular disease and has actually kind of gotten you even more excited about helping out?
Well, before I get to the disease, can I talk about the enthusiasm and the love that I see from Global PAD? That's the first thing that stood out to me. I'm new to this and I'm learning about PAD as I go along, but it's just the zeal, if I may, that I've seen in you. Like you really want to help the patients. You really want to help people, and I like that. And what stood out to me about PAD? Walking. Walking is very good.
Walking, and did I mention walking?
Walking.
It's so important. And Douglas will tell you that, gosh, when he first started trying to walk, Douglas, what did you think when they said, well, the best medicine is walking? What was your reaction?
Well, when you said that, Andrew, a minute ago, my first thought, I keep having these two words pop up in my head: claudication and collaterals. And from where I started, 6 years ago to where I'm at today, and we have a lot of people in our organization that couldn't walk to the end of the mailbox, and now they're walking to the end of the street. And it is that thought that walking is my number one medicine. And I have to be my best advocate in that. Even when I don't feel like I want to walk, I need to get up and walk because I want to save my legs and my life. And walking is the medicine. Walking is the number one medicine that we have to do. And I have to be responsible for that.
Yeah, it's what we do have control over, right? As individuals, it's the one thing that we can control.
The one thing we manage, I manage it today. I can't.
Ooh, he hates the word control.
I hate the word control. I hate that word because there's nothing I can control, but I can manage. I can manage the ability today to build collaterals.
Yeah.
I can walk till my claudication says stop. And it said stop, and my brain goes, I can't walk anymore. My legs are screaming at me. The whole universe is saying, no, stop. But then I have to take that responsibility and take that next step because I know that the human body is an amazing mechanism.
Yep.
Before I knew about those words, Kym, I never realized that when you walk and you get to that claudication point, your body will go all by itself without your knowledge, without your control or your body will go, uh-oh, I have a blockage. I need to create a collateral. And it will begin to do that. And then we learn about that word and how we build collateral. So I get to that claudication point and I take that next step.
Yeah. Seriously, that's amazing. But Thomas, what happens when your disease has progressed to a point where everything seems to be blocked and you're awaiting a procedure just for a Hail Mary? How do you
Yeah,
get yourself moving and grooving and building those collateral vessels?
at the minute, it's really, really hard for me, Kim, but I do my walk arounds and stuff like that, and you know how my situation is, so I do. But I think the biggest collateral that I ever built in my body goes from my mammary all the way down to my groin. It's one of the biggest arteries that Dr. Walker seen and a few other doctors. It's absolutely massive. But it helps me. But the problem with mine is where I'm got below that, you know, in my I can go so far and I have to stop because
Yeah.
I just can't go any further because of the complete blockages both legs. Um and
But you
then
push it pretty far.
yeah, I push it. My biggest problem though at the minute is standing. As soon as I got weight on them, oh boy. So I'm hoping that this Hail Mary procedure coming up is the Hail Mary procedure.
But
You
the
know,
thing about you, Thomas, the thing about you, Thomas, is this. I've known you 5 years now. I have never once heard you quit. Not one
Yeah.
single time have I heard you say, I'm done, I quit, I ain't going no more, screw it. I almost said a bad word. I've never
Fuck
once
it.
heard you. Yeah, yeah, well, yeah. I've never once, and that's the amazing thing about where you are and your spirit. You get up every day and you find you a purpose for that day, don't you?
yeah, 100%. You know, I've got to the point where I said I've given up with the procedures. Let me do my own thing that works me at the gym and walking and stuff like that. But I would never give up on this. And even although I was already told there was no more that could be done, I always believed that someone somewhere out there is going to try like one more time. I always ask just one more time, get through it, you
And
know.
we did. We got
So
one more time. We got another
yeah,
time out of it. But we
yeah,
also just need to buy more time because innovation, as Thomas and I have been working, we've been working together on this, haven't we?
yeah,
Between your research and my research, we're just finding every single no stone left unturned. And we're hoping that there is a type of procedure where they can take blood just from your arm and they've been able to isolate the cell, the actual cell in which collateral vessels grow or that triggers it or something of that sort. So then they isolate it, they replicate it, replicate it, replicate it, replicate it, replicate it, and then they re-inject it into the foot or into the calf to start trying to stimulate angiogenesis or that collateral vessel growth in the legs and in the feet. And as long as you can keep the blood flowing in the feet, your feet are going to stay attached, right? As long as you can keep it in, the moving. So, but we need to get that. It's still in a trial phase right now. And as you know, with trials, it just takes time and they add more sites. And we just need to hope that they're going to, and I've put a little bug in their ear, but I'm hoping they're going to add a couple of sites in Louisiana as well. So, and that's one of the other things that we're looking at trying to do with PAD trials and padtrials.org is we want to learn over time where people need trials to be located, who's searching and were they able to find a trial or they weren't able to find a trial. What's the story? The people that don't find a trial are just as important as those that do in terms of the value that this site and our partnership with another research organization that does a lot of PAD work. That's what we're trying to build here. So hopefully, Thomas, we can just keep one step forward, one step forward, one step forward, um, to hopefully, keep us going to a point where there is the ultimate holy grail option for you.
Yeah, I have been looking though, and I've been looking at the oh, I forgot the stem cell one, and what you were on about, and I just can't find nothing around here. I did find some, but that was back in 2023, and they they never went no further with it. They got studies that I don't think they were high enough to go through FDA approval or whatever. I don't know.
Mm,
But in Texas, I found there had been like two or three of them.
yeah. Yeah, there is. And I did find another doctor that's doing the one with bone marrow. So there are a couple
That's
different
the one I was
ones.
on about. Yeah.
Yeah, so I know that they're doing that in Dallas. If we could get you to Dallas, my friend. I don't know what it would take to participate in it, but I just was on the phone with the doctor the other night. Oh my goodness, he was telling me the story. He had to fly out over the weekend out of state to help some doctors in a pretty tough situation where they tried to treat this patient, but they just didn't have certain skills yet. And they wanted so badly to save the leg, but they ended up making things worse. And they ended up with compartment syndrome down below the knee. And it's just bad news. So the doctor said he thinks the guy's going to lose the leg, but he said, God, you know, just really be careful where you go and who you go to when it comes to this disease. Just because
That's
they can doesn't mean they should.
that's what I wanted to. Can we take a side step with that? Let's bring something else that all comes together here. The
Yeah, take it where you
very
want.
importance, the very importance of second opinion, third opinion, getting those different opinions. Just because you meet that one doctor, he's got the white coat on, he says all the wonderful things, he looks good, or she looks good, or she smiled, the smile is great and all that, doesn't necessarily mean they're the CLL fighter that you need for your disease. So, and we've run into that issue here a little bit with some people is not wanting to get second opinions, just trusting that primary doctor that they think is great. But the
Yes, we
important
just had
for
that,
my
Douglas.
uh-huh,
Yep.
my importance was going from the doctor I had here to coming into the group, getting a second opinion and a third opinion, and getting to the right doctor. We got to be aware that even Thomas going from one the doctor couple he'd been through, each one has given and has learned and gotten him to a better place. Same way with me, and we have a lot of people in our group, but we need to get out of that thought process somewhat that one doctor is the end all to be all. How many doctors do we know don't believe going below the knees? How many doctors do we leave not doing this or not doing that? The doctor I had went straight to all bypasses, didn't do nothing else. So I'm glad I got with the group and was able to get with Kym to find the right doctors to address where I was with my disease. So
We
second
just had one,
opinions.
Douglas. Yeah, and the person had come to me, and I had suggested to go across the street to a different set of doctors, because there were minimally invasive options available. This person ended up with bilateral, meaning both legs. Bilateral is both legs. Um, Femoral popliteal bypasses. A femoral popliteal bypass is a bypass where they can use a cadaver vein, they can use a piece of plastic or whatever the material is, some sort of synthetic graft, um, or your, of course, natural vein, and they can reroute blood flow, attach it to the thigh, and then reroute blood flow through it and attach it either behind the knee, or they can attach it in the calf, in the tibial arteries. You have three vessels below the knee. You have the perineal and two tibials, anterior tibial in the front, posterior tibial in the back. But there is a minimally invasive bypass now available called P.A.D or the detour system. And the very first case that was done by Dr. James Joy, who invented it, he's still going strong 16 years later. And he's doing great. Of course, it's not just the tool, it's also making sure it's offered with the right presentation of disease and with a skilled set of hands, of course. That can all, and also your risk factor modification, that also determines the outcome. But needless to say, this person just messaged me and said, "Oh my God, I ended up with these bilateral bypasses and there's complications. And I ended up with a fasciotomy, meaning that the calf, there was swelling because they call it compartment syndrome was occurring. And so they had to open her up on both legs and let pressure out. And now with the fasciotomies, there's some black in there, so meaning that there could be some gangrene forming if there's no blood flow. And what we find with a lot of these cases, this is why we always say get another opinion outside of that network and make sure that the second opinion has a different set of skills, an advanced set of skills, that they know how to take wires and balloons clear into the feet if medically appropriate to heal a wound, and give you another shot before amputation. But in this case, her tibial vessels, she might not have blood flow below the knee. So it means they might have turned on the faucet by placing this bypass, but didn't check to make sure that the plumbing below, the three arteries below, could support the faucet being turned on. And so the blood has nowhere to go. And it's just not able to heal the wound from the fasciotomy. And I know you can like and trust your doctor because they might be at a big name, prestigious place, but it doesn't mean they are an advanced limb salvage specialist that is right for your presentation of disease. It is
And
so
how
important.
and how often do you hear this? This is another thing about what we're talking about is that, well, this doctor may not have these skills, but I know one down the road. And how often do you hear, well, I can't go down the road. I can't do this. I don't have transportation. I don't like going to that city, or I don't like going there. When I was
What was the
using,
one?
I would walk uphill backwards naked to get high. Now,
Yeah.
think about cancers, all the different cancers. I know people that drive 6 hours for breast cancer treatment, but we run into the issue sometimes with. I was driving 5 hours to Doctor W in Houma, Louisiana, from where I live. How What am I willing to do to save my leg and my life?
It's a good question. And you bring it up because yesterday we dealt with it. We had everyone in our network helping this one person who said they were on deck for bilateral below knee amputations. And the doctor said, "Whoa, I'm getting him in Thursday, Kym. No problem. Expedite, expedite, expedite. Let's get him in." And the person says, Oh, well, I can't do it this week. I made an appointment for 3 or 4 weeks down the road. And I was like, what part of time is tissue that you don't understand? What part of this is a progressive disease? And for every moment that you wait, there's more and more plaque building up in those arteries. They're becoming more and more shut down, leaving you fewer and fewer and fewer options. So if a doctor says amputation, you'd think you would say, just tell me how high to jump and how far, and I am going to go and find and seek whomever can give me that final Hail Mary chance. But I'm surprised each and every day with and I don't want to be derogatory or anything in this, but it's the only way to explain it. It's excuses. It's what are your priorities? And I understand that everyone has so many responsibilities and you end up putting yourself last. But what good are you going to do other people and everything else you have going on if suddenly you have no legs?
This,
Wouldn't you be
this, this,
better
this,
serving them if you were healthy and 100% whole yourself?
this is kind of what we run into between trying to get people to understand the importance of PAD, and because I don't think I would ever hear anybody who had throat cancer or lung cancer say I can't do this, I can't go there. They're going to find a
They'll
way
find a
to
way.
get there.
They're finding a way. Yeah.
But we struggle with that with PAD, getting people to understand the importance of, well, you know what? I have both legs because I drove 4 hours. At
Yeah.
what point? Because there's no excuse. We will. This group will come together and get you where you need to be, one way or another. We always back
Well,
on the
we'll
management.
figure out a way. We'll
So
figure out
there's
a way. Yeah.
so the rationalizing and justifying why I can't drive from from here 2 hours to Houston is it doesn't make sense when I want to keep both legs.
Yeah, I know Thomas. Thomas, we had a very expensive Uber ride one day, didn't we?
We sure did. We sure did. That
We
was
got there, didn't we? We got there.
we we did. After like two or three different Lyft drivers, and then when the lady got there to pick me up, I was like, "Ma'am, I have to be there for this specific time, and it takes this long to get." She she took the scenic route backwards, going on the interstate. If that makes any sense.
Oh no.
Oh, I know what
We
he's
got
talking
there in the
about.
end. Yeah, we got there in the end. Um, and then when I got there, well, it's a price you pay for being late, but they already had someone down there that was similar to my situation, so I didn't have no problems with it. And I get down there at 8 o'clock at night to get my procedure. But
Yeah, but at
Let's
least,
see.
right?
I've gone,
You got it.
but I've also gone through I don't know how many people, like different opinions. I think it's like five or six. One when I was still working at the casino, and I was walking like 7,000 steps a night. It's when I had gangrene. But I thought I had it, and I was right. But I went up to ER, and they wanted to keep me, saying they wanted to do another bypass. They were the one who did the second bypass that I got gangrene, MRSA, and flesh-eating bacteria from. You know, and so they told me if I didn't stay, I was refusing treatment. I said, well, I guess I'm going to put down there when I sign on your paper, I'm leaving for these specific reasons. I want to keep my leg. I don't want amputation. And I left. And then I went to somewhere else, you
Yeah.
know. But you got
But
to go
Tom
wherever you have to go.
Yep.
Thomas, that's getting the education in it. Getting that's what I, you're right, Andrew, and is this group provides the amazing information that some people need to make those choices. If I'm a smoker, I'm going to find a way to get a cigarette. If I'm hungry, that I'm gonna find a way to get Whataburger. I'm gonna find a way to get the thing. So it's the same thought process here, and it's the education that we need to be to. My brother will tell you, if the doctor called my brother at 6:30 and said, if we don't do this bypass, he's gonna lose his left leg.
Yeah.
My brother will tell you today, with what he knows today, I would have told that doctor, button him up. I'm coming to get him. We're going somewhere else. So it's the knowledge, it's learning to be my best advocate and be that. And what am I willing to do that?
And we
No
should bring in,
excuses.
I do want to mention that I don't mean, when someone needs an amputation, we help them along the way. And we worked very closely with Les Leg Morehart, whose CEO just became Miss North America as the first amputee. She's also an amputee, and she's a PA in the vascular world, but she runs Les Leg Morehart, and we help patients who do end up with an amputation to continue to thrive and continue to meet their obligations, and to know that they can live a normal, happy, better quality of life, than the pain that they were in before. So we help everyone at every level of disease. But Marie is one. Andreen, meet Marie. Oh, and we have Potsy, who just came on, and we have Beth and Wanda. Oh my gosh,
Wanda,
everyone finds, and everyone's jumping on. Andreen is new with us with the Global PAD Association this week. And we're helping her to understand what the patient experience is, and allowing her to ask. I don't think we've allowed you to ask questions yet, because we keep talking too much. But if you do have questions, Andreen, you could definitely ask them. But Marie has an extensive experience with PAD. I think she is definitely a pro with PAD. She's one of our PAD pros, huh, Marie?
I'm holding at 74.
74 procedures she's had. But this little lady over here, there's no mileage that is going to stop her from going to see the best of the best of the best of the best. She even drives across bridges she doesn't want to cross. I know you do, and you just did today too. But we've had you in hotels, staying overnight. Oh my Lord, you fight for it.
But I have 2 legs.
Yeah, yeah. It's crazy. She was on deck for amputation how many years ago before we met?
Or July 1st was 4 years ago.
Yeah.
They said there was nothing else they could do. The only thing left was to take my leg. I walked out, and 4 years later, I got my leg. But it is a fight. You got to be willing to go see the best that she can find by you.
so distance is not something that we need to be worried about that much. Think about like Patsy, British Columbia and Mexico to get the treatment.
Yes,
That's a big drive right there.
it sure is. That would be days.
Yeah. I think he goes to Mexico for nothing more than the sun treatment. Little
Yep.
extra vitamin D. That's really good for you, right, Potsy?
Yes, it is. It helps. It
It
definitely
certainly
helps.
does.
Yeah.
Oh, and I love when you're on the beach and you're doing a little bit of grounding.
Yes.
We had Dr. Vincent Rowe from UCLA who said that although we have Dr. Alper that says he doesn't want to see PAD patients and diabetics walking in bare feet, especially diabetics. He had a patient that was able to prevent amputation and grow collateral vessels through grounding. So earthing,
Really?
some people call it. Walking the beach.
Yeah. Yeah. And I enjoy walking the beach.
Yes, you
So
do.
I'll
It's
do more of
amazing.
that. Hopefully I'll do more of that this year.
When are you planning to go?
if I can go, it'll be the beginning of November. Well, I booked the flight for November the 4th.
Okay.
So,
And by the way, I heard you have some updating to do. You have a pretty big weekend last weekend?
yes, my middle daughter got married. She's 34 years old. She's got my 8-year-old granddaughter and all of my girls. So I've got 3 daughters, one that lives in Calgary, one's in Vancouver. They both flew here a week and a half before the wedding. So we had all kinds of family time together. It was just wonderful. And the wedding was absolutely perfect. Everything was just beautiful.
Oh,
And
yeah, and
But
you did more than you thought.
yes, so a year ago, my oldest daughter got married, and I went to that wedding in a wheelchair, and I couldn't give my own speech. I wrote out a speech that my nephew stood up and read for me. And this year I was able to walk to the wedding, and I spent all day there. I lasted way longer than I thought. I didn't get home till after 10 o'clock,
My
and
gosh.
and I thought I was going to be leaving at 6 or 7 o'clock. And I was able to stand up and give a speech. Um, the whole day was just perfect.
so
And
where you were last year to where you when you laid in bed that night, can you describe that feeling of being able to do that? Because you worked really hard to get where you are.
Yeah, you
Everything you've
did.
been through, all
yeah,
the pain, I mean, we
yeah.
Marie and I and all of us watched you lay in a hospital in the hallway for 3 days.
In the hospital hallway, Andreen.
A
No joke.
hallway.
Yeah,
They
And
didn't even have
it's
a bed for him.
and to you sent me a picture Saturday evening, and it was like you could just see the smile on your face, being
yes,
able to do it. It was really cool. How did
Where
yeah.
that
was my
feel to be able to?
picture, Potsy?
What's that?
Where was my picture? I didn't get one.
I'm sorry, Kim. I will send you some pictures.
Darn
Send
privacy
her the
issues that we have with our PAD navigators. Douglas doesn't share a thing.
send her the video of you dancing with your daughter. That's the one that I thought was amazing to see. It's a shame you couldn't post it on here. To watch
yeah,
you dance with your daughter was just
yeah.
it really was.
And he
It
has
would,
not had a procedure. He has not had a procedure. This is all Potsy pushing and pushing and pushing.
yeah.
All you, my friend.
No, I hadn't thought about that, but you're right. I was able to improve my condition. I mean, drugs, one drug in particular, it made a massive difference for me. Um, but yeah, I haven't yet had a procedure, although sometimes I feel like I'm getting very close. Um, but it felt so good. I thought about it um, the morning of the wedding, realizing that I was going to be able to go there and stand up and give a speech for my daughter. Um, I I I felt like I was a better father, I'll tell you that, because I was able to do that. And I mean, yeah, when I came home, I was thinking about the year before when I went and left in a wheelchair. I could only stand up for the father-daughter dance for about 30 seconds, and that's all I could handle.
But
Um,
you did it.
I did it, yeah. But this year, my daughter cut the dances, her and her husband's dance and my dance with her down to about 1.5 minutes, but I could have danced with her for 10 minutes if I wanted to. I mean, it felt great. It felt great. It was wonderful. I, it
That's just
brings
awesome.
it brings tears to my eyes, I tell you.
And
I
as
tell you.
Douglas was saying, when you were in bed that night and you were thinking about the day and reflecting upon that day, and I'm sure you played it over and over again of the dance with her. Um, how does that prepare you to move forward and continue to persevere?
Well, I'll tell you, it has an impact for sure because I've thought about that. My my pad condition is getting worse. I can feel it in my legs. I'm I'm not able to walk as far as I could 6 months ago. I'm feeling a lot more pain, and the pain's different. And so I'm guessing my blockage is getting worse. But honestly, it's given me a drive just to keep going. And I've committed to myself that every day I'm going to get out there and walk, and I'm going to try and walk further every day so I can hopefully improve my condition.
I have something
See,
that
that's
might
the
help you.
that that's the part that is like Thomas, Kim, is Potsy I've never heard him once say I'm done. He
Nope.
keeps pushing forward. Even
Yep.
we all talk to him on those days that he's a pain level of 10 and he can't think straight. But he still gets up, he still tries, he still pushes forward. And
Yep.
that's why we get strength and hope and courage and inspiration from each other, knowing that
Yeah,
you're going what you go through, and we talk on the phone and
yeah,
where you at. I walk down to the beach. I'm sitting on a side bench on the walk having a cup of coffee. You're
yeah,
not on the couch, you haven't given up, and you keep going.
yeah.
Yep.
That's a
I
push
got
up.
I got something that you're gonna love, Potsy. This is so up your alley. So we have confirmed that Dr. Mary McGray McDermott is going to be presenting for our PAD orientation certificate program. And this is one of her trials on cocoa and walking. And she did a 6-month randomized pilot study of flavanol rich cocoa drink. And it was 3 times a day, and it was called the Cocoa PAD study. I thought you'd like that. And
Yes.
people actually walked further, having
Awesome.
3 cups of, and this isn't like your regular hot chocolate with sugar. You don't want to do that. You might want to add stevia, maybe a little vanilla bean, into it. Dr. Michael Danzinger suggests stevia is his favorite one. I personally use either organic coconut brown sugar or raw agave, but I guess those can also spike blood sugar. So if you're sensitive, think about stevia for a little bit of sweetness. But 42.6 meters further in the 6-minute walking test, while the actual placebo group that didn't have it, they declined. So now they're doing a larger trial at padtrials.org, and they're doing it at Northwestern. So anyone watching, if you're in Illinois or you're in an area of Indiana close to Chicago, they're doing the study there, and they are in fact recruiting. So, and she's going to be doing a recording with us on August 3rd. If you want to be in the live studio audience, we're not going to broadcast that. We're going to pre-record it. But you're welcome to email us at info@padhelp.org if you want to join. But September 19th is our PAD orientation, which actually Andreen is going to be working on with me. So excited. Also, we just confirmed that Dr. Eric Szymski, world-renowned P.A.D. researcher from Beth Israel, former Harvard, he is going to be speaking, and he's going to be talking about Douglas's favorite topic. What do you think it is, Douglas? Collaterals.
Could it be collaterals and building
Exactly.
collaterals, the importance
Yep.
of collaterals?
Yep. And which arteries can you grow collaterals, and when should you have a procedure versus walking? And yeah, he's going to touch on all of that. So anyway, but
That's the
I got a
amazing thing
little
about them.
taste of the presentation for Mary, and we're going to be focusing on yeah, I like this. It's like, when you what is it? Wash, rinse, repeat, whatever, rinse, repeat. Walk, rest, repeat. I love this. But it's walk until your leg discomfort reaches a moderate to strong level, mostly strong. Discomfort begins, but you keep going. That's where your collateral vessels are actually growing. I thought this would be, and Andreen, I think I sent it to you earlier today, or I sent it to you last night. So she'll be able to see. But for each one of these presentations, Andreen's helping me with creating some questions that you guys will be able to answer. So you ultimately at the end could get your certificate. But the fitness tracker is not enough. I mean, this is the best presentation I think I've ever seen on PAD and walking as medicine. It's so simple, and it's powerful. She says, week 3, you don't really feel like much is happening. But she says that if you measure it, you time yourself walking a set route once a month. So how you can tell, because you can't see your collateral vessels, and sometimes you might not realize that you're walking faster, and so you might be walking faster and only to the same place. Um, so she says you want to actually time yourself walking a set route once a month, log every walk in the My Steps app. Nice plug she gave us there, right? I might have had a little something to do with the slide deck. Trust the numbers, not the feeling. So that's, I think, as she says, very important. And then the cocoa, that's so important. But the science, she has so many studies at Northwestern. So if anyone is in the Illinois, Northern Illinois, not Effingham, Illinois. I don't think we've gone a show without saying Effingham, Beth. Um, I love that Effingham, but you're getting ready to leave Effingham, so we're just gonna have to keep saying, Douglas, what did you say we were gonna say? Now that you're no longer in Effingham or not far from Effingham, so we're
Yeah,
still gonna say it. Sorry,
we're
Beth.
not gonna be able to throw that out there like we could before, because she is moving. And
Yep,
it's got a much different name than Effingham does.
It's
yep.
Louisville. Louisville.
No, that's not
Louisville.
fun. That's not fun at all. There's
Not Louisville,
no
Kentucky
funness to
either.
that. Like saying Effingham. Where do you live? I live in Effingham, Illinois. Why are you cussing
They're
at
like,
me?
are you kidding? Are you kidding?
Serious.
What is that, a joke?
Yeah, there's a lot of jokes made about Effingham.
It just sounds like like you're trying to prevent saying a swear word.
It does.
It does.
They had
We're not
effing.
trying to
They
offend
had
folks in Effingham. It's a
so
lovely
last week they
place,
had this. It's called
except for the
effing, and then ham, effing, ham, jam days.
woo,
It was for barbecue and all that
Effingham
stuff.
jam. I love it.
Yeah, effing, ham, jam days. Yep.
And
So
I'm noticing some improvement, Beth. This is the first time I saw you had your neck brace. She had neck surgery
I I still have
recently,
it here. Yeah,
and
I
she
have to
still
wear it
has
until
it,
the
but it's
to
the
wear it
first
until
time
the
I've seen you
30th.
take it off. I'm glad that you
Yeah,
can now take it off.
yeah, I'm sitting in my chair so I can take it off because I'm not moving around a lot, and so
And
it's refreshing to
it's
get it off
probably hot.
sometimes.
Yeah, it probably gets hot and smelly, doesn't it, after a while?
Yes, I need a new one, but I don't know if they'll give me one. This one's gross.
Yeah,
And
it's like
I
it's
want
100 degrees there.
I want to ask the other guy in here tonight. I get jealous of him because he's always somewhere. He's never at home. He's
Oh,
always camping out somewhere.
glamping. No, it's glamping. He
Hi.
Glamping. He's
glamps.
always glamping somewhere, and it's like, where is he this week? Where is he now? What exotic place is he glamping at in his?
I don't know. Are you glamping today, Heinz?
No, actually, I'm sitting in my living room. We won't
Where's your
be,
background? Where's your mountainous background? In Colorado.
that's on Zoom. But
Oh,
but we're going again in August. We're going to Santa Fe, New Mexico.
ooh,
Uh,
that's beautiful. They have a great jewelry store up there that I love, window shopping.
uh, we've been there a few times to Santa Fe. We're also going to Taos, New Mexico for a few days. And
fun.
I think you need to adopt a son, and I volunteer.
well, hey, I'm retired. I don't have hobbies except walking and camping or glamping. So um,
That's true.
that I do walk. I mean, that's a
Yeah,
hobby.
share a little bit of your situation for Andreen so she understands you have a very different experience. I mean, you have Marie with some clotting, disorders, Beth with also some clotting disorders. Douglas now has more clotting, but his was more textbook atherosclerosis, right, Douglas? Wanda was textbook atherosclerosis, Thomas also. But I think Thomas also had some clotting happening, but Heinz had a very unique situation.
Hi, Andreen, and welcome aboard. First off, people get cancer, and guess how they treat cancer? They remove it, but they also get chemotherapy or radiation or both. That happened to me in my leg, right in the knee area. So I had a tumor uh, removed 1980, got radiation, and 2019 I started getting claudication in my calf. Come to find out, I had P.A.D in that leg. My left leg is fine. My right leg, all messed up. The radiation zapped the bad stuff, but also zapped the good stuff. So caused blockages, and not only in the artery, it messed up my veins too. Same area. So I got stents now. They've blocked, but I keep walking. And as Douglas always says, walking is best medicine, and it is. In my case, I went through the pains, and it was terrible, really. But I could tell the more I walked, the better it was. I mean, I would walk 6 or 7 minutes, and eventually it was 8 or 9 minutes before I had to stop. And then eventually I was walking 3 miles without stopping. I
Yeah.
still get, I still get right now pain in the calf, but I walk through it because it's minimal. And the doctor, he doesn't want to do anything, and I agree with him. Let's just try the walking. That's what I'm doing. Um, Possibly, if I do get something done, and again, that's only if it's worst case, it'll probably be P.A.D.
Oh
And
yeah, the minimally invasive bypass.
yeah, I'm a good candidate for that.
He
Tied
was, I
in with,
think, wasn't he the PI for the study?
yeah, he's done it many years ago, and one of the initial people that do that. He's always in the front line of all these new studies, but yeah, he was one of the initial people. Um, One thing about what I heard it in the beginning of your show, with the show, is people traveling. I'm still remembering about a patient up in northern Wyoming. If I remember correctly, Kym, you had to go
Yes.
down to see my doctor. And if you're familiar with Wyoming, it's no fun driving through. it is, I mean, it's boring. And you got wind blowing from all different directions. There's no towns in between northern Wyoming, depending which route you take to get to Colorado. And yeah, but 350 miles of almost nothing to see. But
Nothing.
they were determined to get there, and yeah, they were taken care of. But yeah, camping wise, we got a few more camping trips planned, but we're not going like to the East Coast or West Coast this year. We're just staying more in Colorado and New Mexico this year. But
You need to come
we
down to
enjoy it.
Texas.
It's too hot. Now people go down there as snowbirds down to like Brownsville and McAllen down there for wintertime because they got massive campgrounds down there, but that's not something we want to do. It's we still have a home, so we like it in our home. And believe it or not, yes, I'm in Colorado. We don't get the amount of snow that people think we do. The mountains get it, but we don't.
Yeah.
Actually, we're bone dry here. We need rain and snow. The mountains need it also. But yeah, that's my story.
Nice.
We
What
can't,
about Wanda?
yeah, we can't leave the
She
middle of the
knew.
country out either. We can't leave the middle of the country out there and above Thomas and me.
We got to check out Mississippi. Wanda. Wanda and I did find her another doctor that does PTAB, but it's a she vascular surgeon. She just started doing PTAB. We're actually going to interview her, Wanda, September 19th. She has confirmed that she will be our a vascular surgeon and share a PTAB case and have her patient there and talk about the importance of walking post procedure.
Okay. Yeah, she's in Gulfport, Mississippi. That's like 2.5
Okay.
hours. So
Which
yeah.
isn't too bad. I mean,
No,
you
I
know,
won't
it's
drive by. I'm not going to drive by myself. I can't drive on Highway 49 by myself. I've got horrible nerves. My son, after he gets, I'll tell him what's going on. Because I had mentioned Houma, Louisiana to him. I said,
yeah.
that's 3.5 hours away. He was like, okay. Because he's like got a lot going on right now. He just got married, bought a
But could
house.
you go? So if you want 2.5 hours, I mean, you could either go out to there or you could go to Lafayette or you could go to Baton Rouge. Um, that would be maybe a little bit closer.
I think Gulfport's probably closer than Lafayette or Baton Rouge.
Okay. I don't know my geography very
I have,
well.
Just
to
avoid the
Lafayette and
storms.
Baton Rouge is a long way further.
Oh, is it?
But
Yeah.
you have to go through Baton Rouge and Lafayette to get to Houma. So
Right. Well, that's what I thought.
yes, you have to go through those two. You have to go through New Orleans, Baton Rouge, and kind of Lafayette to get to Houma, Louisiana.
yeah, it's a good ways. Yeah.
How far is Cleveland?
Mississippi. I don't know. That's North Mississippi.
Ohio?
Who's got their Google Maps open? I need someone sitting with Google while when we're on these shows. It's pretty fun. And you found another doctor that actually was one of the folks in our top 200 most selected doctors that was that had multiple locations. I don't know what the closest one for that organization was for you, but I still haven't heard from your good friend, the vascular surgeon that we connected. It was initially my fault, but I have literally left him 3 or 4 messages. I've emailed him, I've texted him, and now he's ghosted me. So
Let me tell you
I'm
what
not sure what's going on.
Let me tell you what I did do about this. Let me see if I can pull up my email. Can y'all see me or hear me? I'm on my phone. I I emailed because I was reading about AngioSafe, just out of curiosity. So I emailed, you email info at AngioSafe. Okay, so finally, I was, it took a while. I was like, they're not going to get back to me. Okay, let me look through my Joyce Newton, because I was just asking for someone near my area. She mentioned a doctor. Oh, I can't say a name. Yeah, I'll have to tell you. That is like in my area. But what else? It's AngioSafe or the
Santriva.
ATK, Santrava ATK device.
Yeah, the only thing is that I think what your doctor had mentioned is your iliac is blocked. And I don't know if they're using the Santriva. It would have been worth asking, are they using the Santriva device? And Andreen, it's like a gopher. So it just kind of burrows a hole right through the center of the plaque. And we've had 2 patients. One had a 59 centimeter blockage from the thigh down, and another one from the thigh down one had 59 centimeters, one had 60 centimeters, and it just all the way through it. And they're both doing really great right now. So, but I don't know if they're able to use it on the iliac. It might be an off-label use. So you'd have to ask that creatively to say, so have you had a doctor use this off-label in the iliac artery?
Right. And when I finally got my doctor's nurse to be still and listen to me, I had to be kind of curt with her. I said, this is really serious what I have, and I need you to listen to me. This was on the phone. I said, none of this is making any sense. I said, what is blocked? She said, the CFA is 70 to 90% blocked. Well, see, I thought the doctor told me it was totally occluded. And then she said, the iliac system is heavily calcified.
Okay.
That's totally different than what I was thinking. So from
Well, and
all
I'm surprised that the second opinion that you went and got with the other doctor, that if it's only, if the CFA is only like 80% blocked, let's say, maybe 90%. Number one, gold standard is an endarterectomy. That's in all the literature. But number two is, if she's saying it's heavily calcified in the iliac, but it's not 100% blocked, I don't know. You can still get through it with a wire and open it up, but I still don't understand why a femfem is the only option without consideration, at least assessment for, or a discussion of why or why not an aorto unifemoral bypass just on one side versus 2 sides. But I've heard from a couple of vascular surgeons, including Lily Johnston with Lily Johnston MD. You can follow her on YouTube. She is saying that that's a possibility and has had great success with it. But it always depends on your presentation disease, but it also depends on your doctor. And if you only have one option for a doctor and that's what they're good at, then you kind of go with what they're good at, or you have to go find another doctor. But we're going to continue to keep everybody up to date. Wanda, we should get together this week and see if we can move some things forward for you. I don't want to see you suffering anymore. And Doreen, we would love to see you come again on another week. And we look forward to having you answer our PAD Leg Saver hotline. For those, watching, if you have questions about PAD, give us a call at 1-833-PAD legs. Make sure, if you are on YouTube, don't forget to like and subscribe to our channel. And the more likes and the more people who subscribe, the more YouTube will end up kind of pushing it out there so that more people can get this amazing information, and hopefully it'll help save life and limb. Have a great week, everybody.
You too.